entertain a couple of questions. Over to you, Provincial.
Thank you very much, Ms. Ranchi. Good afternoon to MEC, MEC Math, MEC for Health. Also, good afternoon to the Executive Mayor of OR Tambo District, Councillor Mesul Ngondwana, and good afternoon to the newly elected Speaker of the district municipalities, as well as the senior government officials that are here. Also, good afternoon to you, members of the media. Colleagues, we have called you to communicate an update on our COVID-19 resurgence management in the province. This has been necessitated by recent surge in active cases and discovery of the Omicron variant of concern by our scientists, which saw many Western countries putting travel bans on South Africa, a move that has actually affected our economy. COVID-19 cases are increasing at a rapid rate in our province. Active cases currently stand at about 6,368, and on the 12th of December alone, we recorded about 2,097 cases that were reported. We have also heard this week that our President, President Cyril Ramaphosa, has also tested positive for COVID-19. We wish all the people who have been diagnosed with the virus, including our President, a speedy recovery. We want him to be fully healthy soon to continue to lead the fight against the pandemic and our economic recovery efforts. Our two metros, the Nelson Mandela Bay, as well as Buffalo City, account for 50.1% of our active cases, and that means residents in both metros must take extra care of their health during this festive season because the virus is spreading faster in these two metros. Gatherings are a dangerous place to be during this festive season. Chances of people catching the virus in gatherings are very high. Akho mntu uzobethwa ke ngokungayi kwiziyunguma nemicimbi ekhoyo. Into isemntwini ukuba abeke impilo yakhe phambili nempilo yabo abathandayo. Our people must make serious choices about their attendance at these social gatherings. Siyayicela lento siyayazi lixesha leziyunguma, lixesha lemigidi, njalo njalo. Ingakumbi abantu who are not vaccinated. Because it has now been proven that if you are not vaccinated, standing at high risk of ending up in hospital, if not ending up in heaven. We urge the people who are organizing gatherings to adhere to health protocols of ensuring their guests wear masks, sanitize, and maintain social distance. I know it is a difficult situation to manage, but it is the responsibility of events organizers to protect their guests against the spread of the virus. Umuntu obiza abantu makathwale uxanduva lokuqinisekisa uba abantu bayasanithayizwa, abaze emcimbini kwakhe abantu bane-masks. Uba abantu bayakwazi subavumela abantu baze kwakho benganxibanga zi-masks emcimbini, bajike egeyithini. Abantu bawube befikile mabahlaliswe ngendawo zabo ezawukuqinisekisa uba bayabhekelelana kungabikho bantu abanawube bangosulelana kule virus. Babe sikwazi ngoku ukuthi umuntu ongekho vaccinated sumvumeleze kwakho kuba uzakwenza umcimbi kwakho ngenjongo zokonwabisa abantu kanti uzodala ukufa kwabantu kuba beza kusulelana ngevirus. Akho umuntu orhalela uba kuthiwe besinomcimbi kwabani emveni kokwalo mcimbi kwagula abantu abaninzi basweleka. Izawuphelisa ke ngokuna obamnandi bubenza balamcimbi kushiyeke ukufa kuyingxaki phakathi kwe-families. We urge the people who are organizing this gathering indeed to make sure that people adhere to these non-pharmaceutical protocols. With weather permitting, we advise that all gatherings be held outside or in our ventilated venues Siyayazi phaya emakhayeni kubakho imicimbi kuthiwe umgidi uqhutyelwa kulaa ndlu enkulu noba nguRondaville. Sicela abantu bakhangele intente bazivule kumiswe intente phaya umgidi uqhutyelwe kwindawo efanelekileyo kungenziwa izithethe amasiko ngenjongo zokokuba abantu bezawubulalana. Imeko yesiqhelo sisahlukene nayo, siphila kubomi obunzima kwixesha elinzima kakhulu lale COVID-19. Poor compliance with regulation by events organizers and the public will lead to higher transmission rate of the virus, and that is something we must avoid, as it could lead to hard lockdown, and that would affect our economic recovery. Our biggest worry going into the festive season and the emergence of the Omicron variant of concern is the unvaccinated people. Abantu abangagonywanga basenzela ixhala kakhulu kuba sibonile xa bechaphazeleka ile ntsholongwane uba yenza ntoni kubantu abangagonywanga. Our scientists are still studying the Omicron variant to figure out its function of being transmissible, ability to escape immunity from infection and vaccines, and ability to cause severe diseases. What we certainly know is that Omicron is about 2 times more transmissible. People who are not vaccinated are about 10 times more likely to be admitted to hospitals, and that vaccines are still highly effective in protecting against severe diseases, hospitalization, and deaths. The good news for now is that our latest data shows that we are at 10% utilization of our hospitalization beds, and there is a low demand for oxygen thus far. We want to keep things that way because anything to the contrary would spell trouble for our healthcare system. It is not late for people to get their jabs to protect themselves against serious illness, hospitalization, and even death. To date, more than 2 million people have been vaccinated in our province, and we have administered about 3 million to date vaccines. From that number of 2 million, 1.8 million people are fully vaccinated. There are people who registered but have not shown up for the vaccines, and there are some people who have not shown up for their second Pfizer jab. Siyabacela abantu abatofileyo isigonyo sika Pfizer batofa kakanye mababuye abo bantu. Xa ujonga lamanani abonisa into kokuba inani elisondeleyo pha ku-200,000 linani labantu abangekagqibi ngokupheleleyo ukuvaccinata. Siyabacela ke abantu abasele begqithelwe lixesha baze ngaphambili bayofumana isigonyo sabo sesibini sika Pfizer kuba sesinaso nesesithathu ngoku ekuthiwa yibooster yokuqinisa ngakumbi amajoni omzimba ukulwisana nale ntsholongwane. So siyabacela abantu ke asele befumene isigonyo kodwa bengasigqibanga isigonyo mabeze ngaphambili. Abantu bakuthi siyabacela mabayithathe ngokundilisekileyo into yokugonywa, bayinike imbeko ubulali, yiyo enokubasindisa ekuhlaselweni ngamandla intsholongwane. Asikwazi ke ubanyanzelisa abantu ngento esingaqinisekanga ngayo. Siqinisekile xa sisithi abantu mabayogonywa kuba siyibonile isigonyo basenza ntoni kwimpilo zabantu. Ndisitsho nje sizifumene ezethu izigonyo kodwa loo nto ayithi siphumile engozini. Umongameli utata uRamaphosa ebegqibile ukugonywa kodwa ikwazile ukumhlasela le ntsholongwane. So sonke siyayazi into we are all susceptible to this. We can all be infected whether you're vaccinated or not, but it's important that you must be vaccinated so that we can be able to mitigate the effects of this virus. Lonto ke ibonakalisa ubungozi bayo nokuzondelela kwayo phakathi kwethu kuba siphila nayo le ntsholongwane. Iza kusosela ke xa ngaba asifuna ukuza ngaphambili sigonywe. The unvaccinated people remain our number one priority to protect the health system from being overwhelmed, to prevent severe diseases and hospitalization. For the unvaccinated, we feel it is time government implements a mandatory vaccination as a precondition to access public places and workplaces. It can be that in the middle of a war, there are some who continue as if it's business as usual, mingling with vaccinated people daily. Government is doing a lot of education awareness on vaccines. Millions of South Africans have vaccinated and proven the myth against the vaccines wrong. The vaccines are free. There are no valid reasons why people are not getting their jabs. Hence, vaccination should be a precondition to access public places and workplaces. So sicinga ba esisindululo umongameli besenza uhulumende asiqwalaselayo sokunyanzelisa i-vaccination apha elizweni into esiyixhasayo nesiyikhuthaza kakhulu kuba sibonile ubungqina nemisebenzi eyenziwa i-vaccine. Nangona abantu besosuleleka siyababona ba amanani abantu abagonyiweyo akade asibeke phansi koxinezelelo kwizibhedlelo zethu. The vaccination program will now be decentralized and localized kwi joint operation centers zethu na kwi district operation centers as led by mayors and speakers. I'm happy that the mayor of OR Tambo district, newly elected, is here, and I'm also happy that the speaker has joined us as well. That shows the seriousness we have to ensure that we establish those war rooms in our local as well as our district municipalities. But also, this includes the leadership that we want from all leaders across the socio-political spectrum, all leaders from business, civil society as well. Coverage levels, program indicators will be monitored and at a sub-district levels to address the disparity of uneven coverage of vaccination and unequal COVID-19 outcomes. Every sub-district will be supported to vaccinate about 1,000 people a day and will be provided with outreach teams to conduct community vaccination. Sekudala ke siyiqhuba kwasaqala le program sine outreach amanesi ayaphuma ayezilalini ingakumbi ke kwilali zethu apho singenazi clinics abantu bayo vaccinate emaholweni njalo njalo. So lo program sizayiqinisa ke ngakumbi kuba isincedile kwilali zethu abantu baphuma ngobuninzi babo bayo vaccinate xa kufika onompilo amanesi kwakunye nogqirha bezonceda abantu bakuthi ezilalini. So lo program siyibonile biyasebenza kwaye sizayiqinisa ngakumbi. The 39 sub-districts will have a combined daily vaccination of 39,000, which is the target of 40,000 we need to achieve to fully vaccinate the adults, expand vaccination to over 12 years old and provision of booster doses to the elderly. The strategy for decentralizing, localized, local mayor-led VUMA vaccination programs is our best effective fourth wave resurgence plan to protect our health system, keep our economy open and avoid social disruptions of risk-adjusted above level 2. Our Department of Health, with their dedicated healthcare workers, have carried the province thus far. The last mile of the VUMA vaccination program is the baby of the Premier, the executive mayors, traditional leaders, the business leaders, and civil social society in mobilizing communities to vaccinate the 40,000 persons a day that we must achieve. The Department of Health has reached a plateau of the maximum of 20,000 per day. To double that number, we need to unleash the entire provincial leadership to be the trusted voices to urge every citizen to comply with the non-pharmaceutical intervention. Take their jabs and to keep social distance between now and March 2022, or 22nd of March. On that note, let me also address the concern around food in our hospitals. There are no food shortages in our hospitals. Food, water, medicines are non-negotiable, and government always makes budgetary provision to have enough supply of these items. From time to time, our social partners such as Gift of Givers and would donate items to our health department to support us, and we've been working with them. Where need arises, they always come in. We just needed to tighten up our administration around these issues so that we don't get all these kind of some hiccups and delays in the system. We have made it very clear that the health is a constitutional responsibility. It's not something that we just give it to our people for the sake of giving to them. We must always make sure that those non-negotiables are always available. Health indeed is an apex priority of government, and the budget we spend on health indicates our seriousness to achieve health outcomes. We are also alarmed and disappointed by the continuing loss of life in the traditional initiation season, with 23 deaths recorded thus far. On top of that, we are currently having 51 hospital admissions with various complications that could have been avoided if men in communities played their part in the process. How do you explain to mothers of these boys that they died in our care because of septic wounds, dehydration, and assault? Kanti senzani lento nyaka nonyaka amehlo elizwe funeka ejonge e-Eastern Cape? Kuthethwe ngokubhubha kwabakhwetha. We need an agent provincial indaba on this issue to make sure that we continue with our awareness and mobilization of all stakeholders to play their part. Iyasikhathaza lento yokusweleka kwabantwana abangabakhwetha. Ngoku i-report esinayo ithi abantwana abayi-23 sele beswelekile, and abantwana abayi-51 basezibhedlele. Into ebuhlungu kule 23 ekuthiwa iswelekile ngokuna yaba bantwana yi-7 qha ephuma kwi-legal initiation schools. The other number is from illegal initiation schools. So ikubonakalisa into kokuba nangona sibethe insimbi yofaka isikolo, bakhona babethe insimbi yokhupha isikolo ngaxeshayo. Xa sibeka umthetho sizama ukuregulator nokuqinisekisa uba abantwana bakhuselekile, bakhona bangayinaki noyinaka loo nto. Noko silihlazo, ibuhlungu lento. Actually, it's another form of gender-based violence. If we continue with this, simply because amadoda akakhathali, abantwana abangamakhwenkwe xa benikezelwe emadodeni, babona bephulukana nobomi babo, sithetha ngabantu ebebengazusweleka, if ebengathanga uyoluka ngoku, lo mntwana ngesaphila nangoku. Uswelekile simply because ufune ukwenza lento ifanelekileyo yalapha yokokuba awelele ngaphesheya kwisintu esidala. Siyakhalimela lento, siyayinqanda, siyabacela abantu abangotata ngobuninzi babo. Nami bendinabakhwetha abahlanu phaa ekhaya. Noba bendiphi apha ephondweni, bendihamba noba kusebusuku ndiyogqitha phaa ekhaya ngoba bendilikhankatha. Akhona amakhankatha akhoyo phaa, kodwa bendingenawuxhomekeka kumakhankatha ngefowuni athi hayi abakhwetha barayithi. Ndiyazile uba luxanduva lwam lokokuba aba bakhwetha noba ndiphi, noba ndiseGqeberha, noba ndise-Alfred Nzo, indlela yam mayihambe iyogqitha ebakhwetheni. Bakwazi abantwana ukuba sibase bephila, sibabuyise bephila. Siyabacela abazali, into yolwaluko lisiko elijongwe zinkosi, luxanduva labazali. Akakho umntwana ongenamalume, ongenatata omncinci, ongenabhuti. Imbi into yabantwana abasweleka esuthwini sibukele. Imbi into yabantwana abaswelekela ethontweni. Siyabacela abantu bakuthi noko kwanele ngoku. Siyazibona ezinye imeko ezingapha kwamandla ethu, njengalo umkhwetha ofumene ingozi ngenxa yodlala nomhlekazi, kuthiwa ke kudlala nomhlekazi ngesixhosa, okanye ke kukubethwa lizulu. Yimeko engaqhelekanga naleyo. Nakwenye indawo ukhona nomnye umkhwetha ofumene loo ngxaki, wamkelwa yibhuma yakhe kwaphaya eXesi, yancothuka ibhuma yakhe elele, wasinda lowo umkhwetha. Kwenye indawo ebendikuyo izolo apha kwa-Ward 15 eKing Sabata Dalindyebo, umkhwetha naye umkelwe indlu, xa iphuma endlini wahlangana nezinki lesitshingitshane, walimala lo mkhwetha. Ngethamsanqa lakhe yena usesesibhedlele. Siyafuna kuthatha elithuba sigqithise amazwi ovelwano kula makhaya anaba bantwana bekufanele uba ababhubhanga kodwa babhubhile ngenxa yemeko yokungakhathalelwa kakuhle. Ayisekho into yokokuba abantwana bangaseliswa amanzi for 8 days. Abantwana asinabo ngenxa yezinto abazityayo nendlela asibakhulisa ngayo, abanomelana nemeko yokuhlala iintsuku ezisibhozo bengaseli manzi. Kudala loo nto sayithetha okokuba ayilosiko ukungaselisi abantwana amanzi. Sigqithile kuloo nto leyo. Abantwana maboluke, sinike isiko, imbeko, kodwa abantwana impilo yabo masiyikhathalele sibajonge. Ibuhlungu into yoba kuthiwe umntwana uswelekile ngenxa yoba womelwe ngumzimba, phele amanzi emzimbeni. Ayikho loo nto leyo, siyayinqanda, mayiyekiswe ngabantu abasafuna uyenza. Kodwa onke ke amathonto apho sinomthetho khona, abantu abasebenza ngokusemthethweni bayayazi loo nto. Ingxaki yethu zezi illegal initiation schools. Ngoba okokuqala sizazi ngosekubhubha umntana. Uba besizazi before abantwana babhubhe ngekubhetele, sicela ii-communities zethu ezi zinto zenzeka phambi kwenu bazali. Amabali afana uba kusuke ukuthi hayi ingcibi ibingekho kwathathwa enye indoda nje uba yolusa apha aba bantwana. Awunodlala ngobomi babantwana ngolo hlobo. Ayikho loo nto leyo, and kodwa sifuna amapolisa enze umsebenzi wawo kangangoko. Ndiyayazi uba baninzi asele bebanjiwe abantu ababanjelwa le meko yokungakhathali nokudlala ngobomi babantwana bakuthi. So nezi ntlanganiso sizibizayo azuzuba nasisombululo, azuzuza nasifo zonke ekunyangeni le ngxaki. Isifo sokungakhathali sisifo esibi ekufuneka wonke umuntu ahlukane naso. We must take responsibility ngezinto ezenzekayo, siqinisekise uba abantwana siyabajonga, abantwana siyabakhathalela kangangoko sinokwazi. Akukho mntwana uyazi into yasebakhwethini, uyiva ngabantu basebakhwethini. Uyawuthi azayazi, ayifundiswe, akhuliswe ngendlela erayithi, akwazi naye akuba indoda afundise abanye abantwana indlela erayithi yasethontweni. So siyabacela aba bazali singaphinde sithi yinto yenkosi. Iinkosi zisebenza nathi, zisebenza namakhaya. Masizinzise amakhaya ethu kuzokwazi ukuzinza ukuhlala. Ukuzinza kokuhlala kuzawuzinzisa ilizwe lakuthi. Singabi nazo izinto ezifana nezi zokokuba abantwana abafunde eziyunivesithi, abantwana benzo grade 12, umntana engenanto asuka abheke ebakhwetheni kuthiwa akabuyanga. Funeka kuyochazelwa loo mama lowo onjalo. Umama ogcine umntana for 9 months, emgcine emthwele for 9 months, aze naye amfundise ubomi, amfundise uthetha, amfundise uhamba, ambeleke, enze zonke izinto. Athi umntwana ukuba na 18 years, umama amnike umuntu ongutata. Umuntu ongutata amqhomfe umntana ngeentsuku ezisibhozo ezabakhwetheni. Noko into ekumela kunjalo, into yokukhalinyelwa. Sonke masiphakameni, siyinqande lento. Mhla amadoda aphuma inqina, izawuphela lento. Siphume lo mkhosi sonke kwindawo esikuzo, sihambe siye kulamathonto siyowajonga nakwezo initiation schools. Siqiniseke into yokokuba akwenziwa izinto ezinxamnya namthetho nezinto ezidelela amalungelo abantu. I-gender based violence le sihlukumeza oomama abathwele nzima bethwele abantwana, sihlukumeza abantwana, child abuse. Kuba abantwana babe beyazi into kwaluka mhlawumbe ngebe beyakwenza bhetele kunale nto siyenzayo. So siyabacela abantu abangotata, ndiyagxininisa kule ndawo. Ibuhlungu ndithetha nabantu base-Eastern Cape. Akunokuba ngathi e-Eastern Cape yona ndawo yobulawa kwabantwana abangabakhwetha. Ndiphawule ke beke ndavizithela ezi centers bezitesta abantwana i-COVID-19. Ufumanise abanye abantwana abaninzi ingakumbi abasuka ngaphandle apha eprovinsini balapha, abantwana bebehlala eKapa befunda khona, abantwana bebehlala eRhawutini. Xa bezokoluka ngoku, xa beyotestwa pha bafike batheste positive. Ndizibonele ngamehlo am phaa ecofa imvaba, ndiye phaa ndafika phaa kwathiwa ngezolo abayi-40 abantwana bajikwe sebelapha. You can imagine umntana othi uzokoluka kuthiwa uzokoluka because uteste positive. That's why besisithi ke abantwana abavaccinatileyo yi-advantage leyo, because loo mntana lo ungakwazi ukummanage bhetele nasebakhwetheni. Kodwa ongavaccinatanga yi-problem. Awukwazi nokuqala uthi umntana onjalo ungathatha i-chance ne-risk yoba umse ebakhwetheni. Now we have families who must bury their sons for undergoing a practice that does not kill people when it is done correctly and legally, with great care by communities. The fact that most of the initiates we lost were in illegal schools means some of our communities are not playing their part in safeguarding our tradition. We wish to close our statement by talking about the recent hailstorms that have affected our people in various parts of our province. We have seen damages caused by the storm in OR Tambo, affecting particularly King Sabata Dalindyebo local municipality, Mhlonhlo and Nyandeni. I visited some parts of this King Sabata Dalindyebo Ward 15 yesterday apho bendiyozibonela ngawam amehlo ubungozi balento. Ndiyavuya ke urhulumente indlela aphendula ngayo, urhulumente wasemakhaya bobabini omasipala, local and district, are doing good job working with the province. We had the opportunity yesterday to have a minister, Deputy Minister Pam Chwete, being part of us from Human Settlement. Ukuqinisekisa uba sisebenza kunye abantu abangenandawo zohlala sibakhangelela indawo zohlala ngokukhawuleza kuba wonke umuntu urhalela uba neChristmas emnandi, ayifumane iChristmas kwi-comfort yekhaya lakhe. Abo sikwazi ukubancedisa, sibancedise ngoba sibathengele amazinke, yonke laa nto abanoyisebenzisa yokuba bavuselele amakhaya abo. Siyababulela oosomashishini abathe baphakama beza ngaphambili ngakumbi apha eMthatha besiza bezokunceda aba bantu bebanika zonke ezi zinto zoba bakwazi uvuselela amakhaya abo, njengoko norhulumente elandela inkqubo nemigaqo karhulumente yokuqinisekisa uba abo bantu nabo bayancedwa kakhulu. Izolo siyibonile ihlasela lenkanyamba futhi phaya eFort Beaufort okanye Bofolo eRaymond Mhlaba yeza yazothi tshitshilile nalapha ngakoqonce kodimbaza sibona phaya ifloods ebezisenzeka. Kuyabonakala siliphondo elinengxaki nezizitshingitshane. Le nto ye-climate change iyafuna ke siyiqwalasele okokoko because ngelinye ixesha yenziwa nasethi nayindlela esiyiyo nendlela esiziphatha ngayo. I-important into yohlonipha indalo, funeka indalo siyihloniphe ngamaxesha onke kuba uba ngaba sityala umoya sawuvuna isitshingitshane. So siyayazi loo nto leyo, so kubalulekile ezinye izinto sizijonge sizenze ngendlela efanelekileyo nendlela ebezikade senziwa ngayo ukukhusela iimeko ezinjengezi. Kodwa neenkcubabuchopho zethu siyafuna uba ke zijonge ziqwalasele ngokubanzi kuba seyithande uqheleka le nto. I think for the last 3-4 years almost yearly sinayo le devastating storms that are hitting these parts of our province, particularly this area. Abanye abantu basasokola ukubuyisela ubomi babo esiqheleni since 2017 bebethwe zinkanyama. Siyazilandela ke zonke ezo meko zinjalo ukuqinisekisa uba abantu bakuthi bayancedwa ngurhulumente kulungiswe ingxaki. As I've said, our teams are conducting assessment in all the affected areas, and short-term support and relief will be offered to affected families by government departments. We are a caring government, and our caring nature will once again show at this difficult time that is experienced by our people. It was painful to hear the story of a 2-year-old child who died on the back of his mother. Painful. Ngenxa yenkanyamba phaa kwa-Ward 15. Kubanye babantu abaswelekileyo phaa ababini, kubantu abathandathu abaswelekileyo balapha eKings abathatela inyema. Omnye wabo bantu ngumntwana obena 2 years osweleke esemqolo kumama. Ibhlungu libale libhlungu yitrauma ongenawuze ukwazi xa ungumzali ukuyinyamezela. Siyafuna ke ugqithisa amazwi ovelwano nakuloo makhaya anyembezana asentlungwini yokushiywa ngabo babathandayo ngenxa yele meko yezi zitshingitshane neenkanyamba ekuthethwa ngazo ezihlasela apha kule ndawo. So singurhulumente sawuqhubeka sicupha sicwangcisa injongo zokokuba iimeko ezinjengezi xa zinqandeka zinganqandeka njani. Sisebenzisana nabantu bakuthi ndiqinisekile isisombululo singakwazi ukufumaneka. Enkosi kakhulu.
Thank you so much, Premier, for the message of government. Once again, I wish to recognize the MEC for Health, Mama who is amongst us, the District Mayor for OR Tambo, the Speaker, senior government officials that are amongst us, especially the CEO of Nelson Mandela Academy who is hosting us today. Colleagues, I will now give over to you. I see Premier and MEC that we have PNCA amongst us, we have SABC, we have Daily Dispatch as well. We will now give them an opportunity to ask any questions that they wish to ask in relation to the speech that you have, or to the statement that you have just rendered in this media briefing. And colleagues, the Premier will be assisted or supported by the MEC as well as the Executive Mayor of our Tambo in terms of this process. Can we now take hands? I see your hand, Fundi. Do we have any other hand? Okay, I think we have Fundi Swap from the
Okay, thank you, Kusi. Premier, you are saying that we have 2 million people vaccinated in the province, and we have an estimated 6.6 million people in the province. What does it mean in terms of vaccination in the province? And I also hear that you are saying that the health department is vaccinating about 20,000 people per day. And previously we had about 30, 40 or 50, even 50,000 people vaccinated per day. What happened to the numbers? Why are they dropping? Is the department maybe lacking resources to vaccinate those people? As I said, that it was about 50, 40,000 per day. And another question about the initiation. You are saying, Premier, there is a need for an urgent provincial indaba on the issue of initiation. I'm sure this is not the first nor the last indaba that will be held. What exactly needs to be done? Because this has been going on for years, Premier. Many years. Young boys are dying in the Eastern Cape. It's not even funny now. Ngaphandle kwe-indaba le, Premier, what else do you think can be done? And I hear you are mentioning that ODADA need to do something. They must ensure that our boys go to initiation and come back alive. But besides that, what else can be done? I thank you.
Thanks, Fungi. I will take Sasa. Sasa, you move quite a lot. Please introduce yourself and the media house that you represent. You will also take EICA, and I also have a question that is coming from the Herald and WhatsApp. I will also encourage other colleagues that are listening to the briefing via the virtual platforms to quickly send their questions via WhatsApp so that we can have an opportunity to attend to them. Sasa, then Putnam.
I was going to ask the issue of vaccine hesitancy, but you think you touched on.
Okay, thank you.
Thank you so much, Mrs. Kosi. Premier, you've already mentioned that the numbers are increasing drastically, and we are already approached festive season, as we have seen. Number of people coming from places, provinces like Western Cape and Gauteng, where the numbers are already sky high. So what strict measures that you think that, are there any strict measures that you think that you're going to put in place this time around, talking about beaches and parks where people flood in numbers? What are you saying about that?
Thank you, Putnam. I think the last one would be the one from Sikelele from the Herald, and he's asking Premier how active is the Omicron variant in the province, as well as what is the positivity rate. Thank you so much, Premier Robert.
Okay. Thank you very much, Kusela. I will give MEC to come in first, and then I will be able to come and deal with all other questions. Funeka aphendule apha uyabhada for le vaccination nentonto nezibuzayo.
Thank you so much, Honorable Premier. Thank you. Greetings to yourself, the Honorable Executive Mayor of the OR Tambo District, the Honorable Speaker, the senior management from OTP, Department of Health, the CEO of the hospital, all officials in our media. Thank you so much for these questions. Yes, the decline from around 50,000 to 20,000. There is this serious fatigue that we are noticing. That people, in particular after we were at lockdown level 1, there was a perception that there is no more COVID, even though scientists have been saying that this thing is coming back. Even when we're at level 1, it was still amongst us, and they were telling us, come November, December, you should expect the 4th wave. But after coming closer to their analysis, they said maybe by end of December to January. Unfortunately now, in terms of the numbers, we are almost saying we are at that 4th wave, because almost all our districts are now at response phase, which means the numbers are suggesting that scientists were correct. But our people, we are trying everything. Messages, we are trying everything with partners, in particular the public sector, to an extent of even having these vouchers. Initially they were 100 rand if you go to get some groceries with our other partners, and now it's 200 rand. Trying to encourage our people to say, if sometimes you are saying you don't have money to access these facilities, even though we've tried to make sure that they are accessible, they are closer to where people are living. But sometimes people still say, hey, I don't have money to go. So at least if you save that money for grocery, use it to go for vaccination. Then the voucher approach was also an attempt, in particular, from our private partners to assist in that regard. Yes, I agree. As we all know, we can't hide the fact that the Department of Health has some financial constraints, which sometimes even the cars that we hire to do the outreaches to far-fetched and far-flung areas in terms of our deep rural. Sometimes we get those stops and goes, but we continue to try to get whatever we can get to reinforce the work that we do. As we speak now, we have since added the vehicles, and the outreaches are still continuing. But I must also say we had escalated the matter to the Premier. We are happy that the Premier held the PCCC with the newly appointed leadership from municipalities, because we have noticed that the municipalities, in particular districts, jocks, and some local jocks, they are not doing as they were doing before. This matter is not treated as a disaster. It is treated as a health issue. Hence our appeal says all our leaders, in particular the newly elected leaders of municipalities, the mayors, as chairpersons of the jocks, both district and local, we are appealing to them to revive those jocks, to make sure that there are programs, not only jocks sitting, where we are seeing districts hands-on and local municipalities, in particular on the Vuma vaccination campaign, we are seeing a lot of good progress in terms of achieving the targets that we are setting ourselves. And an example at point here is Alfred Nso. We have seen great improvement there, great performance, in particular in Tabangulu and also in the Winnie Madikizela Mandela municipality. So we are saying if we can work together and deal away with the issue of thinking vaccination program or COVID-19 response is a matter of Department of Health, at a local level, we can go far. Vaccination hesitancy, it is still a problem. We are seeing an improvement in terms of men who are coming forward to come and vaccinate. We are happy with that, because as we speak now, we are 40-60. Remember, there was time when we were almost at 32, 68, and so on. But in particular, the older age group, that is 60 years and above, be it females or males, there's good progress there. But we are worried about the younger ones, the 59 years and younger. We are still worried, in particular the latest category of 12 to 17. The percentage is still very low there. Yet we've got this target that we must meet, because by the end of December, we must have covered at least 70% of our own population as a country and as a province. But coverage means at least the first jab, if it's Pfizer. It's not the fully vaccinated. But we are happy that by 1st of December, we're already beyond the 2 million of those who have been fully vaccinated. And we are close to 3 million now in terms of the coverage. And again, when we look at our percentage in terms of the total population of the province, we are number 5 in the country, with 4 provinces having reached at least the target of 50%, and as Eastern Cape, we are just above 49% in terms of the entire population coverage, which is something that says at least there is great progress that we are achieving there. In terms of the positivity rate, we are at 16% positivity rate, and again, the last issue in terms of the questions that were raised, the strict measures. Yesterday we had the National Health Council, and we are going to be proposing to where the Premier sits the NCCC and the PCCC, which is the Presidential Coronavirus Command Council. We've got some recommendations that we are putting there for consideration, which maybe we may not divulge for now until there's a decision. But we still feel, in terms of stricter restrictions, for now, there's no need, as Premier was saying, even though the numbers are fast of those who are getting infected, but the impact and how people get sick, it's not like the Delta used to be, but we are not saying, therefore, we must leave our people to be infected, but we are most affected as the health sector, because the majority of our doctors